warm good afternoon to all. Today's my presentation is on uterine stump parameter, and an intact ovary was there with a spayed dog, it's a mixed breed dog, and it is a young dog. So usually we choose ovarian hysterectomy in order to check that cyclicity in animals, cyclicity in dogs, and also to check that breeding manners. Usually the owners, we suggest, the veterinarians are going to suggest for OAG, the surgical, even though several complications are also there. Like these complications are, sometimes it may lead to suture lesions, sometimes it may cause some of the adhesions and hemorrhages, of course. And besides that, a part of the ovary or sometimes a complete ovary may also be retained. That is also one of the complications. So this retained ovary again causes the cyclicity in animals. So the purpose will not be served. The owner might have approached us for OAG in order to stop that cyclicity, the bleeding nuisance, etc. But it will be fine. And not only that, it will lead to the parameter also again. That stump, the stump may become again accumulated with pus. So again the major clinical signs of the retained stump will be similar of that parameter. The symptoms, how the dog shows the similar symptoms will be shown again by the if the stump is developed, stump parameter has been developed. So let me give a brief history of the case that we have taken care. So that dog that was presented is a N1. It has been spayed some recently, some less than 2 months ago, and the dog was showing since last 1 week the serosanguineous discharges. However, the normal it's showing all the physiological parameters were within the normal range. So when we performed these vaginal cytology, as usual, this that quantified and superficial cells were more, and we subjected it for the ultrasonography also, because as it is the owner said it's a spayed one, but still it has started cyclicity, which is a clear-cut indication of the ruminant ovary. So just we made an ultrasound examination, which clearly some leftover ovary can be seen caudal to the left kidney. Besides that, anterior to the urinary bladder, I can see a large pocket. So within these few days, we are able to see that a large pocket has been developed. So then we have performed an exploratory laparotomy in order to, and the next day itself it has been planned, and the incision has been taken mid-ventrally and located the left ovary easily, as because much of the ovary or almost entire ovary has been left. So it was ligated now properly and removed completely after taking all precautions without leaving any remnants. Then extended the incision posteriorly, and to check, we have checked that the stump parameter, that means a large mass accumulated with pus, and it has got adhesions also with the omentum. So carefully remove those adhesions, and we have ligated it and removed the stump also, lavaged the abdominal cavity, because already it's a pus and some of the leaky pus also observed. So metronidazole and all other hand antibiotics were kept after closing the suture line properly. So next 5 to 7 days we have taken the post-operative care, and the dog recovered uneventfully. So actually this in this case, the ovarian, even though that entire ovary has been remained, it will start releasing the hormones. So the progesterone is the implicating one for the formation of the parameter. But in this case, it might not be the case, because this has been done recently only, and it is the first cycle of the almost the first cycle of that particular dog. So this progesterone that is available, the same reasons as we told for the stump parameter. So what is required for development of stump parameter is these endogenous releasing hormones, the bacterial contamination, and a remnant of the uterus should be there. Uterine tissue should be remained. So when these are present, when the animal becomes cyclic again and again, repeated exposure to these hormones, these steroids, it will develop a stump again and it will start showing the similar signs as that of the pyometra. But in this case, even though the animal was not showing any symptoms of pyometra, it has developed cyclicity soon after that spaying operation. And in our examination, we are able to see that the stump and it has been removed. So the same, so when we have searched if what might be the other causes for development of such type of accumulation of stump pyometra, if the remnant ovary is not a cause, means that can be due to surgical contamination. It might be due to contamination at the time of the surgery. So bacterial inoculation can occur at the time of the surgery, and that might have led to the stump pyometra. That might be one reason. When I have scanned the literature, there was other cause of, like in one case, a human topical estrogen hormone has been applied with owner for the 1 year duration, and the dog which was spayed 1 year back, when it was a puppy, it has developed the signs similar to that of the pyometra. So that is one case. And in some other case, there was administration of in tamoxifen. So it's a non-steroidal anti-estrogen. So the dog was treated for some medical condition, long-term tamoxifen treatment. So that animal has also developed stump pyometra. So these are the reasons other than the remnant ovary. So surgical contamination and topical or some other use of these steroids. So in order to avoid this stump pyometra, so let me conclude that the OHE, what we are performing the ovarian hysterectomy in the dogs in order to prevent the bleeding nuisance, etc., must be performed aseptically and the entire ovarian tissue. So one should check by opening the bursa and check that the entire ovary is within that bursa or not before we remove that. And we should not that means any ovarian, this uterine tissue also should not be left behind, and aseptic precautions to be taken care before, so that to prevent the reoccurrence of the estrous signs and development of stump pyometra. Thank you, sir. Thank you for giving this opportunity.
Now the topic is open for discussion. Any query or any question? Dr. Jyoti, what was the reason of that remnant ovary?
The remnant ovaries, usually the surgery to be performed, while performing surgeries, that should be properly located first. So when
surgery was done at your place? Or?
No, sir. It was done some local ABC center. Okay. So they have left the ovarian tissue because they have taken frank incision. So they could not taken out the opposite ovary. That means the left side ovary they could not take it out. So it was remained there itself.
And as such it was there.
As such it was there, actually.
So the veterinarians must, when we are doing this ABC program or doing this OH, then we must ensure the removal of the ovary. That is the message to the
yes, yes, sir. Definitely we have to remove both ovaries without any remnants. Even the small remnant tissue will develop in future and it will start cycling, but because it will start releasing hormones again, progesterone. So it will again the dog will show the cyclicity again.
The dog owners are very smart. They can see the veterinarians. The veterinarian has to be equally smart for handling the cases.
Yes.
So thank you, Director.
Thank you.
Now the next speaker is Dr. Ghulam Rasool Bhatt. He'll be talking on the use of vincristine and venlafaxine for treating the venereal tumor in dogs.
Time is ID. Vai, mais surat, bikin قالب مية دارك قالب
Has Dr. Patra come? No, okay. So that will be the last presentation of this session. You can start, Dr. Patra, you can start and you will be given. Are you competing for the young scientist? Okay, thank you.
Respected dignities on the dais and off the dais, Assalamu alaikum and rahmatullahi to all of you. Today I am presenting a clinical article based on our experience at our referral hospital here in our faculty, and we have tested chemotherapy in case of transmissible mineral tumors. And chemotherapy is a conventional therapy, that's a well-established therapy, but we have tested it along with some D-complex protein. That will be dealt later, why we have tested it along with that. So for this introduction will be that the transmissible mineral tumor basically is a tissue-like tumor, and it is contagious always, and is frequently seen in free-roaming dogs which are especially sexually active and involves both male and female. It's a benign tumor, has cauliflower-like growth always, and mainly occurs on the copulatory organs in both male as well as female. The disease affects external genitalia and is transmitted between animals during copulation. Tumors can also spread to the whole body. You can see the lesions on head, forelimbs, hind limbs, and in ventral abdomen. These are the common tumors which are observed in dogs. In male dogs, it's at the fins, and in females, it involves the vestibule and ventrolateral aspect of the vagina mostly. And in other parts, it can involve the limbs. You can see the lesions on the whole body. So, what are the treatment options so far available for this transmissible mineral tumor? There are many options involving surgical excision of the throat, chemotherapy, radiotherapy, immunotherapy, biotherapy, cryosurgery, and electrocardiogram. However, chemotherapy is considered as a convenient and pet owner friendly option. Chemotherapy as a convenient and preferred option, and it involves mostly use of vincristine. That is a drug of choice for this. It can be used at the rate of 0.025 mg per kg body weight. Use slow IV in normal saline, diluted in normal saline first. What's the mechanism of action of this drug? Why it is being used? It basically inhibits M phase of the mitosis, preventing mitotic fusion of the tumor cells, which are proliferated with the help of microtubule formation, and this vincristine basically blocks microtubule formation, so it stops the growth of tumor mass. Chemotherapy is a non-invasive, that's why it's preferred, and has uneventful recovery in most of the cases. But what hinders its efficacy is immunosuppression it causes. And such cases which have been subjected to vincristine show occasionally weak responses and demand multiple shots of injections. And there is a cytotoxic effect which is well established in the literature. So for that, actually we need to give it strictly IV because it is cytotoxic. Hence, routine chemotherapy may require medicinal interventions to boost immunity. What this vincristine does, how it causes immunosuppression, it leads to thrombocytopenia, anemia, and fall in leukocyte count in the cases. So overall, it decreases the efficacy of therapy in TBT cases. For this, we try to use vitamin B6, B1, and B12 combination so that it may help us in new blood cell formation and keep immune system strong enough to fight suppression. Our objective was to observe the influence of injectable multivitamin B1, B2, B6 at every shot of vincristine sulfate, whether it would help in fast recovery and improve cytological and hematological alterations in TVT affected dogs. So our methodology was, when cases were present, we assembled data of 6 cases and 6 cases of TVT, because here we have newly established hospital, and nowadays we are getting 20 to 30 PET cases a day, and among them 1 or 2 gynecological cases we are being reported. So from last 2 years we assembled the data of 6 TVT cases, in which 3 were Labrador dogs belonging to CRPF, 1 German Shepherd and local belonging to Shepherd Total. All the dogs were in the range of 3 to 4 years age, weighing in the range of 30 to 40 kg. So we made 2 groups. In one group of 3 animals, another group of another 3 animals. So in all the groups we subjected the animals to blood sampling for blood biochemistry and pathology with the help of automatic hematological analyzer, and formation of smear. We formulated smears of the vaginal tumor mass and subjected to cytology. So this is the cauliflower like growth which we saw in all the cases, and we made pre and post treatment data and generated that, and did the statistical analysis using t-test. So this is the methodology. Group 1 was subjected to vincristine only, and blood biochemistry was at first shot was done, blood biochemistry and smears. In second shot of blood biochemistry, only in 1 case we could teach blood biochemistry and smear, and in third shot we also observed the same observation. In group second, along with vincristine we gave along with vincristine we gave Tylenol, which contains B1, B6, B12 for 3 days. In the first week, this vincristine is given weekly. At first week, once we gave vincristine injection, we subjected the animal to Tylenol 1 ml IM only for 3 days, and similarly at next shot and third shot. Now, this was the hematology and blood biochemistry we could observe from the cases. Among this, almost all parameters were non-significant, but there was increase in one, blood urea nitrogen, and decrease in hemoglobin content, and increase in total leukocyte count, which is already reported in the literature. So, in the second group, similarly we observed, and again there was increase in blood urea nitrogen, hemoglobin level, and total leukocyte count. So the cytological features of the tumors were that we observed the round cells with uniform cytoplasm and discrete unequal cell distribution, and cytoplasm was stamped light blue with sharp cytoplasmic boundaries, distinctly walled cytoplasmic vacuoles. Nuclei were centric and mostly they were eccentric. Mostly single prominent basophilic nucleoli were observed at 100x, and mitotic figures were variable. So after treatment we could see the improvement here. There was no vacuolated cytoplasm and there was no eccentric nuclei. So we got change in the cytological alteration. The cytological alterations were improved with the help of this treatment. What was the conclusion? That complete recovery in the group second, where we used vitamin D complex, was faster. It took 3 weeks only, but in group vincristine group only, it took more than 3 weeks. And typical cytological alterations in vaginal epithelium were effectively reduced after 3 weeks. TBT in dogs may be effectively managed using intravenous milk in combination with B-complex vitamins weekly for at least 3 weeks. Further studies are needed to prove the side effects on molecular level and further chemotherapy interventions to reduce large mineral tumors in canine. Thank you.
Dr. Bhatt, you were giving this B complex for long with vincristine?
Yes, sir.
At weekly interval?
At weekly interval.
So, what was the other supportive therapy? Normally, when we give the vincristine, the dog or the bitch goes off it.
No.
What we have seen in our clinics.
Yes. Some cases go off.
Yeah, the hepatotoxicity occurs usually after second or third injection.
Because that's why we select trivalent, because trivalent improves appetite. We have seen that with the help of trivalent, which we decompose vitamins, there's improve the speed intake. We use only trivalent.
So you are using vincristine or vinblastine?
Vincristine.
Vincristine. Okay. So that is a gold standard treatment for in case of TBT. So question, any query or question?
Yes. So now, while calculating the dose of chemotherapy gadgets, we generally take into consideration the body surface area. Any specific reason you have calculated dose on the basis of body weight?
Sorry, I could not understand.
Yeah. For chemotherapy agents, when we calculate the dosage, normally we take into consideration body surface area.
Yes.
In this case, you have calculated the dosage on the basis of body weight. Yeah.
It is actually body surface area is more accurate, but because we cannot calculate once the case comes, we have to perform so many procedures. If we calculate for body surface area, that's more accurate. But in case of dogs, we have seen that body weight and body surface area is almost correlated. So we to save time, we give it on the basis of body weight. Otherwise, body surface area is more accurate.
Any more question? So if there are no questions, then we must thank Dr. Bhatt for refreshing our knowledge regarding the vincristine.
Thank you.
Any other presenters still? There are 3 papers, but those who have not come. Is there anyone in the audience? No. Then we must thank the organizers for giving us the opportunity for conducting this session 5, that is on reproduction and breeding. I thank my co-chair Dr. P.S. Mavi and Dr. Kansal for helping me to smoothly conduct this session. So thank you very much.
On the behalf of the organizing committee, we would like to felicitate our lead paper presenters and chairpersons. So I'm requesting Professor Ajay. Professor Paramjit Singh Mavi for the lead presenter. Professor Hemant Shankar Pirar. Professor S.K. Kansal as report here. Professor Paramjeet Singh Mawi as co-chairman of the session. Finally, Professor Harish Kumar Verma as chairman of the session. Thank you. Thank you, Aaron. We'll be starting our next session. Next session on applied subjects, anatomy, physiology, biochemistry, parasitology, pathology, pharmacology. So I request the chairpersons to take their respective chairs. Professor A.K. Upadhyay as chairman, Professor R.K. Bagarwal as co-chairman, and Dr. Govardhan Singh as the co-chairman.
So, good afternoon, one and all. First of all, we thanks our organizers for giving us this opportunity to conduct the seventh session, that is one of the most important sessions for canine practitioners, because all the diagnosis or elucidations of the condition depend upon and Dr. Govardhan Singh is reported. In this session, we have enlisted 3 lead papers. First is diagnostic approach in prostatic diseases in dogs by our Honorable ex-Vice Chancellor Tanwal, Dr. C. Balchandran, and second lead paper is mine. Third is of Dr. Rohitas Dadij. He is, I think, not here. And a few papers, 6 papers are also enlisted for presentation. One is use of probiotics in dog food and its impact on gut health. Pallavi Das. Is she here? Then role of nutrition on pet animals' behavior. Rajesh Nehra. I think he is not here. Then again another paper is Dr. Rajesh Nehra. Sorry, only 2 abstracts are here. One is of basal cell carcinoma in a dog. And another is expression pattern of vascular endothelial growth factor and vitamin in canine uterus. Dr. Devinder Pathak. I think Dr. Pathak is here.
Yes, sir.
Okay. So now, with the attendance, we are going to start the session. So to start with, our most respected ex-Vice Chancellor, former Vice Chancellor Tanwal, Dr. C. Balchandran is requested to take over the dais for his very pertinent presentation on diagnostic approach in prostatic diseases in dogs. Dr. Balchandran.
Very good afternoon. Respected Chairman, Co-Chairman, Reporter, and my dear participants. Now, as the day passed by, it is one-to-one lecture. Anyway, this is we did some small work. We were there in the clinics. And now I thought I can correct something. The prostatic disease is a small review. What is the current status? This is what I am going to share with you. So, the diagnostic approaches of prostate. The topic, picture shows its own correction. Prostate, the X-ray radiography, and the psychological pictures where it is prostate. So this prostatic disease, we take, let us say about the prostate, it is important that it is originating from endodermal epithelial buds from the middle of pelvic part of urogenital surface. That means there is a sharing of the cells that has got certain significance. And if you see that the prostatic diseases are very common, accounting for 3 to 10% of cases, involving 10 years old age, around 8% of them. After less than 4 years, it is very low, 1%. In non-castrated and neutered forms. There are 7 or more diseases that are there. Let us see as we pass by. And if you see the clinical signs of these prostatic diseases, there are no pathognomonic signs, and it is difficult to clinically approach the prostatic disease diagnosis as the pathologies are occurring simultaneously, at times asymptomatic and often underestimated with non-specific signs. And among the many things, prostate, benign prostate hyperplasia is the most common one. And the clinical signs are based on the system involved. In BPH, in general, the clinical signs may be absent because early stages it is difficult to find, but persistent or intermittent hematuria and hemospermia. I'm just highlighting certain points. And let us see in the lower urinary tract signs, most common is intermittent precocious bloody discharge without urination, hematuria, dysuria. This is uncommon, unlike in human beings, there are differences between dogs and human. And urinary retention is occurring in enlargement as well as you find in neoplastic conditions. It's also difficult to demonstrate the compression of urethra, as in the case of dogs, it's not completely surrounding the prostate gland, so mostly you get incontinence rather than obstruction and then no urination. And also you will find in the attenuation of urethral lumen and the enlargement is pressing on the sacral parasympathetic nerves. So there is stretching of the urethra, so you get these conditions. So in BPH, as the diffuse enlargement occurs, the position is moving into the abdominal cavity. So there is certain relief for the GI symptoms. And in acute infections of urinary tract and also hydronephrosis often complicate this urinary retention. In case of semen, in early stages, only hematospermia is seen in early BPH. In later stages, it is affecting the motility and morphology, mainly tail abnormalities are also common in dogs. In GI symptoms, because the enlarged prostate is pressing on the distal colon, there will be constipation, will get fat and stools. There will be tenesmus or intermittent diarrhea and causes obstipation. This is the way it is expressed. So when the enlarged prostate is forced into pelvic inlet, you find when the animal is swimming the defecation and it is increasing the abdominal pressure. So once the prostate getting into the abdominal cavity, the GS symptoms subside because it is moving away from the base, and locomotor disorders can be seen, especially in case of neoplastic conditions. There will be musculoskeletal disorders resulting in stiffness, lameness, paralysis, or edema of hind limbs. In rare cases where infections of the prostate may induce bacterial emboli to leading to lumbosacral spondylodiscitis. It's a very rare in cases. In case of neoplasm, prostatic neoplasm, you will get dysuria, stranguria and obstruction, fecal obstipation, and whereas others have emaciation and hind motor disturbances. We already seen metastasis, foci involving lower lumbar vertebrae, bones of the pelvis, and long bone of the rear limbs. So this metastasis occurs through vertebral venous plexus, systemic circulation, or it can be through direct extension. When we talk about BPH, it's a non-cancerous, non-painful, symmetrically enlarged state, relatively common, as we have said, involving 80% of the dogs, and spontaneously increase with the age because the organ grows till 11 years of age. You will find it. So it is rare in castrated dog, but estrogens are taking 2 months worth can come. The important point is the BPH is an underlying cause for many other prostatic disorders, including prostatitis. So when you find the BPH at early stages, you can avoid the chance of occurrence of future pathological conditions. It is a hormonal induction is treated, testosterone is causing hypertrophy and hyperplasia of SNR cells, and estrogen is in excess status, which causes fibromuscular hyperplasia, squamous metaplasia, and also increasing the androgen receptors. So it is getting sensitized to the estrogen. Prolactin to granulocyte monocyte colony stimulating factor also involving in this state of BPH. And further, estrogen free radicals induce cell injury, and larger nodular hyperplasia is very rare. So that is checked with that. Next is in case of squamous metaplasia, again a non-cancerous enlargement of the gland. When you find there is excess amount of estrogen is there, like in case of Sartorius cell tumor, and then always whenever we see hyperplasia, dysplasia or metaplasia, we also think of it is pre-neoplastic, but it is not so. It's not pre-neoplastic, and then it may involve SNR epithelium of the entire gland. Also there is also the ducts, prostatic urethra, and uterus masculininis. The epithelium you find it is multi-layered. You find the squamous epithelium that could be seen here. And in case of cystic hyperplasia or paraprostatic cysts, it may be a true cyst, wherein they are lined by epithelium. If not, they are called as pseudocysts, and can be seen in many conditions. You see here, and because of abstraction of the ducts carrying prostatic cysts. So the paraprostatic cysts can be congenital origin there over the outside capsule, and sometimes you find there is creatinine is there indicating it is urinary retention. There are serosal infiltration cysts and hematomas are there, but they have no characteristic feature. And in case of prostatitis, it is acute or chronic. So when it is acute, mainly you think of whether it is septic or non-septic. So the sepsis is occurring, but when the gland is becoming larger because urinary obstruction. So this common classic disease in older dogs in hyperplasia, and without hyperplasia in younger dogs in normal prostate. So this is the acute infection can occur hematogenously, and chronic usually hematogenous and ascending infection can occur. And you find E. coli, Proteus vulgaris, Streptococcus, and Streptococci can be descending from the kidneys, ureter, and the bladder. 1/3 is caused by a single bacteria, but many times we find a mixed or aseptic type. So you may find several symptoms. It is asymmetric enlargement, hemorrhagic and edematous. You find malaise, pain, fever, and then later you will get the systemic signs of septicemia, endotoxemia, shock, and may lead to death. And 2/3 of dogs with lutein will show death or during impasse, urethral discharge, incontinence. And there is a more severe form which is involving whole gland, wherein you will find necrosuppurative process. In chronic condition, it is follow-up of maybe a follow-up of acute inflammation. The gland becomes atrophic and fibrosed, and in common in older dogs with variable glandular cystic hyperplasia. It is segmental or coilless, and you will find there are changes that can occur in what we have seen already, and also in case of other one, the brucellosis, also you will find prostatitis, and in systemic fungal infections, blastomycosis or cryptococcus or coccidiosis, you will also find besides mycoplasmosis. The prostatic abscess is very rare complication of infectious cysts. It is around 15% of dogs show which are more than 7 years old. So it is more severe form, as we have said. can involve the entire gland. You may find either single or multiple abscesses can be seen. We have said about the organisms and anaerobic organisms, distemper virus and other things will also be. Nearly 40% of cells are contaminated with the bacteria. Coming on to the cancer, mainly adenocarcinoma, the several forms are there within that, but doesn't matter, but rare in occurrence, and mostly when it is diagnosed, it is in advanced stage with metastatic lesions. So that is the issue with this. There is no relationship between the testicular neoplasia and this, and also compared to the hyperplasia which is occurring, mostly 80%, you don't find that much of neoplasia. That means there is no relation. There is a hyperplasia, and in other instances it is related, but it is not so. So that is a case here. Death is only around 0.2 to 0.6%, and occurrence is 0.3 to 0.6%. So some dogs like Flanders cattle dogs, Shetland sheep dogs, and Scottish terriers are predisposed to this, and also you may not see, as you see in human beings, this case of high-grade prostatic intraepithelial neoplasia or prostatic inflammatory atrophy. You don't see much in case of dogs as in the case of human beings. You can see the normal appearance of the prostate. You find the solid carcinoma in this stomata body central necrosis. You find the acinar pattern, and it is signal-free. So several forms are there. It doesn't matter. Here a carcinoma is carcinoma, that's all. It is a situation, because in other cases you can grade down. Here in histopathologically you cannot grade down. That is the issue here. And the clinical signs you get in carcinoma are lethargy, anorexia, weight loss, coughing, exercise intolerance, and other abnormalities like dull demeanor, dehydration, pyrexia, dyspnea, because when there is involvement of lungs and that. Several diagnostic methods are there, two of them most important. One is colorectal, and another one is ultrasonography, and other supporting things are there in case of digital palpation. So it is not helpful when there is a slight enlargement, that is the issue. Normally it is bilobe, uniform, smooth and median line is felt. In VPK there is symmetrical, smooth and regular enlargement, or sometimes irregularly nodular, median line not felt or less obvious bilobe structure. In cyst you will find venous and lymphatic status maybe beneath the capsule, you can feel it. And prostatitis is not a reliable one, as pain is not evinced in case of chronic prostatitis, it is not excluding other prostatic disease. And in carcinoma, it is asymmetrical and irregularly enlarged, firm, immovable prostate in pelvic cavity, and possibly pelvic defined enlargement of the lymph node. So there is no distinction between hyperplasia and metaplasia. We say because you have to see the based on the age, what is the size and weight can be taken, which are fairly constant in nature, except in case of Scottish terriers. The prostate weight is 4 times more than the dog. So we can do your own other ultrasonography, and then body wise you can relate whether it is enlarged or not. See the blood. Yes, you will find non-regenerative anemia. You will also see in cervical tumors, chronic diseases, leukocytosis with the neutropenia, left shift are seen. And in hyperestrogenism, there may be thrombocytopenia, granulocytosis or granulocytosis. So there can be azotemia, post-renal or pre-renal from dehydration. PAC is not specific, but in case of dogs, it is a canine prostatic prostate-specific artery states. When the level is more than 90 nanogram per ml, this is indicating prostatic conditions. Otherwise, urinalysis will reflect the pyuria, hematuria, bacteria, and then urine sediment is not much helpful. And cytology and urine culture can be used in this. So if you go to the imaging technology or diagnostic schools, they are underestimating early stage of BPH, use and positioning significant influences in case of ultrasonography. So in subtle pH, what will happen is there are many cysts, but still it is not enlarged. And in severe BPH, there will be hyperechogenic peripheral prostatic tissue indicating inflammation. The prostatic parenchyma echogenicity is the presence of hyperechoic and hypoechoic areas located in both prostatic glands. So this is what you find mostly in this. With ultrasonography, normally it is homogeneous echodense. In BPH, the enlargement we already said about symmetric and homogeneous. And since it is hypoechoic, and we are likely to regress spontaneously, prostatic abscess where it will be enlarged, asymmetric and totally diffuse hyperechoic things are seen. Prostatitis, ultrasound is an excellent tool for this, as you can visualize the tissue texture, and chronic prostatitis it is hyperechoic. So you can tell me the time this. In carcinoma, this appearance is enlarged, irregular and heterogeneous in nature, and mineralization is seen, one in the neoplasia, another can occur in chronic prostatitis also. So these are the important ones where you find it is hyperechoic in nature, involvement of glucose, liver, spleen, and so on, where you get hyperechoic models. You already said Thomas Method cannot ultrasound cannot differentiate, but you think of other thing, non-prolactic, symmetric alopecia, hyperphysic, pigmentation, gynecomastia, and so on. We have seen the case of sarcoidosis tumor where hyperphysic is here. And this is one area where you can see a definite pathogenic sign. So there will be extensive penis erythema is seen in this case. So Doppler ultrasound can also be helpful that compared to the normally in BP that we increase the peak systolic velocity, also diastolic velocity and max. And contrast and enhanced ultrasound elasticity can also be used for this purpose. So there are CT, MRI and other things are there. They are very expensive, and by the time when they diagnose animal is in advanced stage. So it's not advised. In case of scintigraphy, you can very simply you can see the lymph node draining. You can clearly identify this, especially focus on median iliac and paratic one. So you can find out that is the critical nature of this one. And of course, CT scan throughout the body, you can scan and look for the metastatic lesions. This locally aggressive, high rate of metastasis, and staging that was always externally done, chest radiography, abdominal echography. And the predictive of carcinoma is an enlarged mineralized state, prostate, frequent finding in castrate. So this is the one, this is more common in castrated dog, but it can also occur in the non-castrated dog also. So mineralization is one of the things. There is calcification that we see. Bacteriological analysis required for the type of bacteria and the sensitivity for the antibiotics, because the treatment time is 4 to 6 weeks, so that we can choose the ideal antibiotic. But empirically, you can start with a ciprofloxacin there. So that is what you can do in this case, and then you can choose the right antibiotics. And cytology can take prostate mastectomy is a good indicator of inflammation. It is negative for inflammation. It is non-inflammatory cytology. So this is one minimally invasive, rapid, and technically easy to perform. And it is very well correlating with the histopathology, that is 80% agreement is there. And you can draw samples from affected nodes, liver and spleen, and look for any neoplastic foci in those cases. Never, because some people say that there may be transplantation of this, but still we can hopefully take out this material FNM. Because still it is considered heterogeneity is said. It cannot be grade these things, but adenocarcinoma is more common. And even in histochemistry also, because it is expressing both urothelial and ductal origin, so you cannot differentiate from where it has originated. So in the treatment depends on diagnosis disease state. If the excessive hormone levels are there in this, you can neutralize the animal, the prostate returns. You can neutralization becomes normal in 4 weeks. You can try the androgen analog finasteride. The dose is given, and also Megistar is also given. So what is the issue is, once you stop it, that the prostatic hypertrophy returns. So that is the issue with this one. And Dr. Prasad already said about this. There are a variety of antibiotics are mentioned because it has to penetrate the prostate. So you should always remember it is always complicated with other diseases that we should take out. In case of carcinomas, NSAID is the most important rather than specific type of chemotherapy. They just suggest this one has got very good effect. And also, since COX is expressed in prostate carcinoma, you can take COX2 inhibitors like pyroxafen or COPA. So chemotherapy, no studied, not studied in canine. Though in men, even in refractory cases, there are treatments of this one and not certain. But not much study is conducted in case of dogs. So also in case of radiation therapy, where they think of total dose and dose actions, so the complications can be avoided. That is chronic colitis and the strictures. Bone metastasis test the quality of light is affected, so that you can use bisphosphonates or samarium like that you can use, and that is preventing the bone desorption by osteoclasts. You can also think of other additional treatments also available, but not much done in case of dogs. With this background, we'll see this is a normal type of cytology, the uniform size, shape, the nucleus, there are no changes. And whereas in case of neoplasm, you find the variable size, shape, the nuclear, chemical nuclear that are present, the smaller cells that are there. So it is quite helpful in case of 5-needle aspiration biopsy, straight as or through ultrasonography guided one also you can take. And this is the case you find the prostate radiography. The mineralized part can be seen indicating the think of carcinoma. And this is chest radiography. You can see the presence of secondary foci here. We said about polydiscitis, so this can also can be diagnosed like this. So in ultrasonography, you can see this is a normal one. So maybe the mode that they are using. So one is normally transverse view, another one is in the sagittal view. So this is a capsule part that is shown here. So there is a homogeneous pathology. And this is an enlarged prostate that we shown here. And we can find cysts. These are areas within the barricades, a larger or smaller one cyst that can be identified. And in case of inflammation, so you can see the hyperactive areas in these cases. So from the nucleus or the one focal one. So here you can see a large abscess that is taken out in here. Here in case of chronic prostatitis, you will find some mineralized areas. So this also we have to look at. So here in case of, this is case of squamous metaplasia, and you also find cavities here in this case. So this is prostatic carcinoma that is identified here. And then you may find sometimes we don't see much of the blockage of urethra, but still this is the carcinoma areas. And second one is hydronephrosis. And third one is the hydroureter, that's what we see here. And also you find the bladder is thickened with a certain tumor that is found here. So normally is ureters cannot be imaged, but in this case it can be done. So this is the case of plasma where you find hyperactive there is a calcified areas. You find that this is the needle that we inserted through ultrasonography. So here this picture you find the calcified area, the fibrous area, and this is a part of the neoplasm. So in the blood flow patterns you can see uniformity here in both ways, and here this is getting increased. You can see in case of Doppler ultrasonography. So this is a picture of CT scan. So you can see the prostate arraying the colon screening, and you find the secondary tumor that is seen in the sacral area. So here, this is the small work we did with one product called as Prosa, with myself and Pradhan. It was demanding the dose of 1 or 2 based on the body weight, and it could significantly reduce the volume of prostate and mark a reduction in liquidity. So it is, Dr. Shuhama, you're talking about Ayurvedic or this other any plant-based medicine. See, actually talking about nearly 80% of the drugs are plant-based only. So you go for the principle somewhere, otherwise it is done that way. So the scope is there always in our situation, which how they were able to find in those days, and they were treating the case. Only thing is we have to put our mind and then look for the right things for solution of different diseases. So that is the thing. So just to brief out this, there are several conditions affecting the prostate, making it difficult to diagnose. So it is better right from the early stages to go for the diagnosis. Look for any prostatic enlargement is there, and think of that there are no distinct signs. And in case of squamous metaplasia, certainly is a tumor defeminization syndrome we think of. And then if we follow these things in the right ultrasonography is one of the best things available currently. Some institutes are having CT, so they can use that one. So, so that way it could be diagnosed. So anyway, I thank Dr. Srivatharji for giving the opportunity and also the organizers, and thank you for the patient listening. Thank you, friends.
Thank you, respected Sri Balachanan, which is announced personality in terms of academic research and even extension also. We really respect you for a nice presentation. Now, in continuation of the lead series, I invite Dr. Ashish and he with us as the chairman of the session. I invite Dr. Ashish Upadhyay. We basically also leading with the veterinary public health department in Patna.
So again, good afternoon and thanks Dr. Agarwal. I am here to present 10 years retrospective study that we have conducted at our veterinary hospital of the Kali. Many of the things that we have observed and going to present before you. Being a regular practitioner, you must have an idea. You might have perceived those things in your mind. Lot many things will be matching, but a few observations may differ from your perception. So those things we are going to discuss over here. Our study is based on the diseases that occur according to the progression of age and increase of the weight of our pet dogs. So, through this study, we have identified the weight-related conditions as well as the age-related conditions that occur in our patients. We have given the emphasis on these things and to have better understanding about the prevention plan and treatment plan that we may follow during our clinical practice. So, during this 10 years study, we have examined 13,266 cases. And these cases were categorized in 5 categories as per age and in 5 categories separately as per the weight of the animal that you are observing on the screen. So, as a total, these are our findings which we have recorded during last 10 years at our clinics. So, if we take skin conditions, we will find as the age progresses, the older dogs, they are exhibiting more skin ailments compared to the younger ones. These things we are going to deal separately as per the diseases that we have observed over here. Lot many diseases, those come in very few numbers, we have omitted, and lot many doubtful cases are also eliminated from this study. So this is the condition, these are the conditions that we observe out of these 10 diseases which we are going to present over here. These are the conditions that occur in various weight group of the animals. Many animals, they are more in age, but they are less in size, so less in weight. So that is the difference this table is depicting over here. If we take one by one, although this table is also giving the right picture, but we are going to take diseases one by one. As far as skin conditions are concerned, we find that as the age progresses, the cases, skin cases, they occur, which were approximately 7% in puppies, but in older dogs they are 32%. Similarly, in smaller dogs, particularly toy breeds, have a higher reported history of skin conditions compared to the large dogs. This is the finding which you might have also observed during your practice. If you take the condition of parasitic diseases, the prevalence of parasitic diseases in dogs shows a unique pattern, remaining static until 7 years of age. But after that, the highest lifetime prevalence at the rate of 25% was observed during the older dogs. That goes up to 28%. And dogs having weight below 10 kg have the highest reported history of parasitic disease. That means the small breeds, they are more prone to parasitic conditions. If we go for orthopedic conditions, that is also more in those breeds which are small in size going through this, because their small size has to bear more of the weight as compared to the bone strength and the skin area. Gastrointestinal cases, as far as these gastrointestinal cases, they are amalgam of different etiological agents. So the prevalence of gastrointestinal condition increases with the age, ranging from 42% in puppies. These gastrointestinal cases are more in puppies. Here something wrongly depicted. More cases are in young animals as well as in smaller breeds, that is 42%. Here also, as per the weight, we find that smaller breeds are having more gastrointestinal cases. As far as ocular conditions are concerned, the prevalence of ocular diseases increases with age, with the highest reported history of ocular condition 10% in the age group of 7 to 11 years. As far as weight-wise depiction is concerned, the larger dog, being more than 40 kg, exhibit a higher proportion of ocular diseases, that is 7%, as compared to small breed dogs, those are having 2 to 4%. P and T conditions. The prevalence of P and T conditions increases with the age, from 4% in puppies to 10% in senior dogs. Similarly, weight-related trends show suitable variation, subtle variation with ENT condition ranging from 2 to 4% in heavier dogs, above 20 kg body weight, while maximum cases are observed in dogs weighing less than 10 kg body weight. Remaining diseases, their cancer prevalence increases sharply with age from less than 1% in puppies to 10% in older dogs. This is the perceived idea and everybody knows it. As far as relation of weight is concerned, the prevalence of cancer is 1% in dogs less than 20 kg body weight to 7% in dogs weighing 30 to 40 kg body weight. And this trend declines further in 40 kg body weight dogs. As far as cardiac conditions are concerned, cardiac diseases are more prevalent at the rate of 10% in the dogs, is 7 to 11%. If you go for weight-wise study, cardiac diseases is highest in dogs below 10 kg body weight. And thereafter, it remains static. As far as liver conditions are concerned, liver diseases are more prevalent with a peak of 13% in senior dogs. And if we go for weight-wise study, proportionally lower prevalence among heavier dogs, ranging from 3 to 5% has been observed. In other groups, 2% only. Similarly, respiratory diseases prevalence peaks at 12% in dogs less than 1 year old age, and as far as weight-wise study is concerned, the proportion increases with the weight, ranging from 6% in the smallest dog to 31% in 30 to 40 kg body weight because of the various kind of food habit and other conditions, other living conditions that they expose for. As far as conclusion and possible discussion is concerned, owner reported diagnosis with affected dogs of varying weight, with more cases of skin conditions and gastrointestinal conditions. Larger dogs have lower skin condition. Larger dogs and orthopedic, ENT, cardiac, liver, but high respiratory conditions. Parasitic diseases show unique pattern in smaller dogs. Skin diseases in older dogs may be due to oxidative damage that occurs because of their habit variation. Then working dogs face elevated risk of orthopedic diseases. Cancer is the leading cause of mortality, increasing with the age. Correlations between serum IGF-1 level and the cancer is increased with the age. Cardiac disease reflects impact of extreme weight. Age correlates inversely with the cardiac disease risk. Limitations include recall, bias, and potential errors. Because lot many cases they don't report after recovery. They don't report to the clinician who is attending the case. So that is, I think, in nutshell about the different conditions that occur in any clinic. At Pantnagar, some different environment is there, so different kind of condition have occurred. But at certain other places where humidity is less, certainly skin conditions will be less. And where difficult terrain is there, heart diseases and orthopedic conditions will be more. So this is all from my side. If there is any question or any suggestion, you are more welcome.
Thank you, Dr. Upadhyay. No doubt, it's a very nice work, and I think it will be very helpful all over country and all over state, especially for the clinical point of view. Because whatever the different disorder mentioned in a 10 years of period, it's really a good data and also helpful to researcher in all academic way to make a project also. And one thing, Dr. Upadhyay, I want to ask you, you told that climatic variation will affect the data. But in my opinion, I think whatever the result you got, in especially Pantnagar, it will be variable in just like Tamil Nadu and Andhra, where the climatic variation somewhere different is a north condition like that. In your opinion.
Yes, very good. Thank you.
Okay. Thank you. On the presentation, I think one presentation is from student, Mr. Pathak. He is here, I think you are invited. And you know the terms and condition, time limit is very well. And that may be a last paper after this session. Okay, you are welcome.
Co-chairman, co-chair, and esteemed delegates of this convention, a pleasant evening to you all. I am here to present my research paper on expression pattern of vascular endothelial growth factor and vitamin D in canine uterus. We all know that for a successful reproductive process to happen, a healthy uterus is required, which is responsible for implantation, growth, development, and expulsion of a fetus. The vascular endothelial growth factor is responsible for increasing the activity of uterine growth by neoangiogenesis. As they secrete, they bind to the receptors present on the cells, and further they promote the vessel formation, that is neoangiogenesis, which is responsible. These factors are responsible for proliferation, differentiation, survival of endothelial cells, and also the vascular permeability leading to the angiogenesis. The vimentin is intermediate filament, which is responsible for fastening the cell organelles together, so they communicate with the cell organelles, they anchor cells to cells, and also they anchor the cells to the environment, and they are also responsible for the epithelial to mesenchymal transition. So, present study was aimed to examine the expression of these two factors, that is VEGF and vimentin, immunohistochemically in the uterus of female dog. The canine patients brought to the hospital either for the military or for the disease purpose performed the sample of this research, and there were 48 samples divided into pre-pubertal, pubertal and the disease conditions, and samples were processed for paraffin 16 and they were immunohistochemically stained to localize these factors. Briefly, they were deparaffinized, antigen retrieval was done, then H2O2 block was done, primary antibody was incubated, with primary antibody was incubated for overnight at 4 degrees C, then secondary antibody, diachromogen was used to receive the color combination and then immunoglobulin for the nuclear staining. VEGF was found expressed in the epithelial cells, in the lining epithelium of glands, also in the endothelial cells, and all the blood vessels which were located in the myometrium and also in the perimetrium. We can note here that the lining epithelium of the endometrial glands, if we enlarge, we will see that they are mostly secreted towards the periphery in the pre-pubertal conditions, which was literally reversed in case of the cyclical animals. We will see once we go to those through. In case of the cyclic animals, we can see that they were similar pattern, but the expression was very high, and we can, if we enlarge it, we will see that the expression is not only towards the periphery, but they are also towards the luminal side. So still it needs to be investigated, is that comes through the secretions in the duct or not. In case of disease conditions, there was aberrant expression of the VEGF. At places where there was hyperplasia, it was more expressed, you can see in the right side panels, and where there was cystic conditions, the VEGF was expressed less. The vimentin was expressed in all the compartments, starting from the lining epithelium to the stromal cells, lining epithelium of the endometrial glands, also in the muscle bundles, around connective tissue around the muscle bundles, in the blood vessels. It was more expressed, intensely expressed in case of cyclical canine uterus as compared to the pre-pubertal. And if we look towards the diseased animal, it was variable and aberrant expression. In hyperplastic conditions, we can see that they have lost expression in case of the epithelial cells, and it was more expressed in the stromal cells in the endometrial area around the glands, all the stromal cells, but they lost the expression in the epithelial cells. And if you see in the right side panel, we can observe that there are certain cells which have from the round shape, they have started taking the shape of a elongated spindle shape, telling us that probably these cells are converting themselves into a spindle shape to migrate. That's how the epithelial cells transit into the mesenchymal cells for their migration. We try to correlate these expression patterns with the expression of BWF and SMA, which expresses in the blood cells and blood vessels, and we counted the blood vessels, and these cytoplasmic reactions were observed both for BWF and alpha SMA, through which we counted the blood vessels, and it was directly correlated with the quantum of VEGF expressed. And it was aberrantly expressed in the blood vessels of diseased animals. To conclude, the VEGF had a cytoplasmic reactions in the lining epithelium of endometrial glands, endothelial cells of blood vessels, and expression was higher in the cyclical uterus than the pre-pubertal and was aberrantly expressed in the disease conditions. The vimentin also had a cytoplasmic reactions in the lining epithelium, stromal cells, basement membrane, blood vessels, connective tissue which form the sheath around the muscle bundles, and higher expression was observed in the cyclical animals and the hypertrophic disease conditions. The blood vessels, which was counted using the expression of BWF and SMA, expressed significantly higher number in blood vessels in case of the cyclical uterus as compared to the pre-pubertal animals, and there were aberrant number of blood vessels seen in case of the diseased animals. Thank you very much.
Really, I appreciate personally very nice work and continuation of Dr. Upadhyay. this work is also very helpful as far as reproduction point of view, especially canine. Thank you very much. Any question from audience? Thank you very much. And
Dr. Pathak, just I want इधर देखिए सर इधर चेयर में कोई बात मैं केवल इतना जानना I only want to know the field significance of your study just in 2-3 lines.
Sir, probably it is a marker to distinguish between diseased animal and a healthy animal. As an anatomist, we planned it between a pre-pubertal and a cyclical animal. What's the expression pattern? But when we started collecting it, more number of diseased animals we had, and that's how it was a marker differentiating between the two. Probably the research and that was how we can implement it in diagnostic process.
Okay, thank you.
This is also helpful. ये जो म्यूनिसिपल कॉर्पोरेशन में जो ये जो रिप्रोडक्टिव प्रोसेस को रोकने के लिए जो हेल्प करते हैं ना, ये एमपीसी के अंदर भी ये इसका प्रोजेक्ट डायरेक्टली हेल्पफुल रहेगा. आई थिंक यू बिलोंग फ्रॉम ओके, तो वहाँ पे यू कैन असिस्ट सम म्यूनिसिपल कमिश्नर and with the help of your higher authority and effort, because we in Indore we are doing like that, and Indore Commissioner Municipal has like 2 important things we will discuss. Number 1, veterinary public health point of view, and he has given permission to us say about motivational lecture under left to land program to the worker involved in drainage of the Nigam, and that is the reason that Indore is being 7 times first in India as far as clean trade is concerned. That will be helpful indirectly. So proposal will be helpful for us. Thank you very much.
On behalf of the organizing committee, we are going to felicitate our lead paper presenters and chairpersons. In this connection, I am inviting Professor Hemant Shankar Brar to felicitate our lead paper presenters. First one, Professor C. Balachandran.
Light on.
Please light on for all of you. Professor C. Please stage light, stage light. Professor Ajay Kumar Upar. Now I invite Professor Azmat Alum sir, who is T2 Honorable Vice Chancellor, to facilitate our chairpersons. Dr. Govardhan Singh, report here. Professor R.K. Bagarwal, co-chairman. Professor A.K. Upadhyay, chairman of the session. Okay, this concludes our session. Please join us for a tea outside.
और हम जो करते हैं वो कोई नहीं करता